Living Alongside Cancer webinar series. Tricky thoughts and feelings you might be noticing. Slides created by Dr. Mia Foxhall, clinical psychologist, read out by Dr. Pascal Harrison, health psychologist. This webinar has been developed to provide brief information and support for people cared for by the oncology and haematology teams at University Hospital at Bristol and Weston. We will be talking about things that may trigger emotions for you. This may be something that you're familiar with, or it might be a bit of a surprise or catch you unaware. Please try to be gentle with yourself and remember it's understandable to be feeling this right now. This webinar is designed to provide some techniques to help respond to these feelings. Additional information and resources are also provided at the end. Please take good care of yourself during the watching of the webinar, especially if you've noticed yourself feeling distressed. However, you can always take a break or stop watching if you need to. You may feel that you would like to have more of a conversation with a psychologist after watching the webinar. If so, at the end of the presentation, we have a list of services you can contact for individual support, including service to contact for immediate or crisis support. We hope you find this talk useful. Why do our thoughts feel difficult? Our thoughts are shaped by the context that we find ourselves in. Our belief systems are developed from our own life experiences. What we make of the world, our culture, or our heritage. Our own personal context is made of early life experiences, our social, family, and occupations. This influences what our mind focuses on, and what becomes meaningful for us really depends upon our life experiences and the context we find ourselves in. Humans are likely to focus on what beliefs will match early life experiences, and this confirm our own belief systems. How does our mind impact us? If we were to close in on how our mind impacts us, we have 1,000 thoughts each day. Some of these thoughts are positive, some are negative, and some are neutral. Different situations or triggers can lead to our thoughts about a situation. Often linked to these thoughts, we have feelings, and we can experience a range of different feelings. Anger, anxiety, joy, happiness, and sadness. This depends upon our interpretation of the situation. Often, our worry thoughts, anxious thoughts, or sad thoughts lead to feelings of worry, anxiety, and sadness. The slide on the screen is an illustration of how our mind can work. A situation is, you're asleep and you hear a noise, a creak in the floorboards downstairs. You think to yourself, is it a burglar? You may start to have physical feelings of your heart pounding, feeling shaky, and chest feeling tight. At this point, you may also notice some anxiety feelings. And then we may be thinking what you might do, and this would be our behaviour. So you could always explore what the noise is, and then you may worry about what it could be. We're going to look at the same situation, but how our thoughts can influence how we see a situation and how we respond. This is the same situation as before, but we may have the thought, it's creaky floorboards. What we might be feeling at the time is that we're not bothered. And the physical feelings that we may have, instead of feeling anxious, may be that we feel sleepy. And how we might respond is that we feel safe in our beds and we go back to sleep. So you can see the tricks of the brain. Our brain can play many tricks, and often our brain looks for cues that reminds us of situations that we've been in before. We may focus in on negative aspects of a situation or possible fears we might have, and sometimes we can overgeneralise and catastrophize over scenarios instead of looking at the situation in a balanced way. We have belief systems about cancer, and when we're given a diagnosis, we have views of what we understand about cancer and how it impacts us. We can think about our own personal situation of how the treatment can cause side effects, complications, or whether we won't experience any of these things. So we may have the thoughts about possible changes for a person's future and not being able to go to work and having an increase in physical sensations or loss in mobility. And this may lead to feelings of anxiety, sadness, worry, stress, confusion, and anger. And the physical sensations that we might feel in the body may confirm some of those anxiety signs. And what our behaviour might lead to is further monitoring or checking for symptoms. What does this mean for me? If we were to break down this cycle further, we may be having thoughts, is this my cancer returning? This may lead to feelings of being anxious. And we may have the usual physical sensations of pain. But this may lead to a change in our behaviour. So we may check for further symptoms and become hyper-focused on these sensations. And this may lead to us worrying. Or alternatively, we could have the following thoughts. Life feels so much smaller now. And this may lead to us having the feelings of being sad or disappointed. And if we were to feel this way, this may lead to physical sensations of being tired or sluggish. And how we might respond in our behaviour is we may do less, and we may not have any coping strategies available. So how can we manage these thoughts and these feelings in a different way? So we may have the thought, I'm worried about my cancer getting worse, but maybe this is me being on high alert. This may change our feelings to being cautious and calm. And the physical sensations may be the normal sensations we normally have. And how we may respond is we may carry on with our daily activity, or we may decide to problem solve by contacting our nurse. There's some of the take-home messages from today's webinar. Your response is unique to you, and that is okay. Thoughts, feelings, and behaviours are linked. Feelings of anxiety, sadness, anger are all normal. Thoughts and feelings have power, and an awareness of these thoughts and feelings and the way that we respond can help. If this webinar has left you feeling like you might need more support, you have the following options. If you or someone you support is a patient of Bristol Haematology and Oncology Centre or is having support from Bristol Royal Hospital for Children, you can always contact your clinical specialist nurse or Macmillan support worker. Or if you're looking for other resources, whether you're a patient, supporter or a member of the general public, you can access the resources toolkits which have advice on how to navigate well-being alongside a health condition. If you need immediate support, call NHS 111 or you can call the Samaritans on 116 123 or shout charity, which is 85258. Many thanks for watching this webinar, and I hope you have a good day.